Hi everybody, my name is Joseph Gerbel. I'm an Indiana State University nursing student. This educational PowerPoint will be for my class NURS444. During these recent months, many of us have heard about social distancing, which has changed the way that we do business as a whole community, as a world. It's even changed the way you talk to your loved ones, or maybe you haven't been able to see a loved one because of the social distancing that's in place. This is why I chose a PAR, or population at risk, as worldwide population. I chose to keep my learning objectives short because social distancing at its core is simple. Though the changes that it brings to our lives and how it affects our lives and our world is often challenging. I hope by the end of this presentation you understand better what social distancing is, you understand why social distancing is important, as well as a couple tips to help incorporate social distancing to your daily lives. A basic outline of how we will meet our learning objectives is presented below. First of all, basics of social distancing. Second, we'll get into limiting risks. Third, why we should all social distance and what's the reasoning behind social distancing. Next is tips for social distancing. And last but not least, some added measures to help reduce spread of infection and help add to the desired effect of social distancing. Before we get into the nitty-gritty of social distancing, I'd like for you to please pause this presentation, look for the added link, follow this link included, which will take you to a short pretest, and it'll assess your current knowledge regarding social distancing. After you've viewed the whole presentation, you'll take this test again, which will evaluate your knowledge gained through this presentation. Let's start with the basics of social distancing. Social distancing has also been called, as it's evolved through this past couple months, physical distancing, due to the ability to connect via social networking, phones, etc. A key fact to remember is that you must stay at least 6 feet from the person next to you to follow social distancing guidelines. Large groups, even when 6 feet apart, are also something to avoid when following social distancing guidelines. This is due to the increased chance of exposure to viruses, bacteria, etc. It's important to avoid crowded places and mass gatherings. This is, again, due to the added possibility of exposure. Related to limiting exposure, it's important to limit contact from others, even though you are keeping your 6 feet distance. And this is because of the ability for somebody to carry a virus or bacteria, show no symptoms, and spread this unknowingly. The CDC recommends limiting contact, even when 6 feet apart. Next, we'll talk about limiting risks. The best way to prevent spread of disease is to limit the risk of exposure. Practicing social distancing is a great way to start. Reducing time spent with others outside your home, reducing time in public places where many people touch objects, such as the grocery store, etc. If able, if you can modify your work schedule, such as working from home, maybe even missing a couple meetings and getting them over the phone, it will help limit your risks. Limit your time spent in public transportation, but as we all know, this is not always possible. And if this is not possible, make sure you sanitize and follow CDC recommendations. And next we'll move on to why we should social distance. A widely used term is the curve, which refers to the capability of healthcare to care for the amount of people entering the hospital. Social distancing is meant to reduce a large influx of people in the hospital due to the rapid spread, thus pushing the hospital to the limit where it can no longer care for the amount of patients that are currently admitted. By social distancing, we give ourselves a buffer zone, which, when you're in close contact and a person coughs, sneezes, or maybe you have that friend that spits when they talk, their body fluids can become a means to transfer viruses, bacteria, etc. Social distancing is also meant to limit the chances of touching contaminated surfaces and people, which brings us back to the previous slide regarding limiting risk of exposure. Social distancing is extremely different from what we are used to and has changed our lives greatly within the past few months. A few tips to help with social distancing during this difficult time. Many people continue to work, though their hours and how they work and what their workplace looks like may have changed. If possible, adjust work and school to prevent close interactions with others. As stated before, this can be done by changing in-person meetings to online, virtual classes, etc. The elderly, immunocompromised, and some with pre-existing health conditions are not as able to fight infection if it was transferred. Finding ways to social distance from these specific groups is highly recommended. Check to see if your grocery store has delivery or curbside services available. Many large chains offer this, and it can be extremely helpful in limiting your chance. Wear a washable cloth, mask, or face covering when out and about and around others. Social distancing may cause feelings of less connectivity to family, friends, and society as a whole. Staying connected by means of video and voice chat, text, and heck, even video games if you need to. If you need to break and you need to get out of your home, go out to a minimally populated place, such as a walk in the woods, a trip to the river, a lake, etc. Just make sure that you're not going to a popular place that's packed more than the grocery store. In addition to social distancing, some added measures to help reduce the spread of infection are listed below. Wash your hands frequently. This helps reduce the chances of spreading disease by cleaning bacteria off your hands. Do this before you eat, after you eat, when you wipe your nose, use the restroom. Anytime you think, maybe I should wash my hands, just do it. When unable to wash your hands, use hand sanitizer. There's many variations on the market, and you can get it for relatively inexpensive. When feeling ill, you should attempt to self-quarantine as much as humanly possible. It's important to check in with your provider if you've been feeling sick for a number of days, because what you're going through could be more serious. When out and about, and also in your own personal home, cover your mouth when coughing. Just remember that bacteria, virus can live in the saliva, which will then live anywhere that you cough. This would be a perfect time to wash your hands or use hand sanitizer. But please make sure you cover your mouth when coughing. It's important also to watch out for items that have been used by others. This can come in terms of clothes, items such as food, sharing a fork from somebody. At this time, if you would please pause this presentation, click on the link that you clicked at the beginning of the presentation, and take the short 10-question test and see if the information that you gained from this presentation helps you more accurately answer these answers, and even if you got them right before, helps you understand the reasoning behind these answers. If you are looking for more information, please follow the sites that I have linked on this page. The first one gives great information as well as links to webinars by some of the top minds on this subject. The next page is a Center for Disease Control, which is informative and kept up to date with current recommendations. Lastly, the link to hopkinmedicine.org gives great information regarding coronavirus as well as social distancing, and even gives illustrations and animations to help the reader understand.